Hi there. Can you all hear me properly? Okay. I've been here for 18 months, but I'm afraid my Scottish accent's still quite strong. So I will try and speak a bit slower for you. If I get a bit excited, I do get fast. But the challenge of always having this spot on the agenda is that I'm the only thing that stands between you and your lunch. So there's kind of no pressure here that we've kind of got to get a bit of energy going. When I was asked to come along today, it was to share with you the story, the journey of some of the work that we've been doing in Scotland. It's not special. It's not something that a lot of other places aren't doing. But it's a good story, and it's something that people are still working on. So my invitation for you today is just to listen, and if there's things that we can connect on, more than happy to keep the story going and share more with you. So this is Scotland. You see there in terms of the NHS, we've got 156,000 staff. Our general practitioners are independent businesses, similar to here, but we do regard them as part of our health system. And 90% of care is actually not in hospital. It's in primary care, which is exactly the same as I find over here. The region that I worked in is called Tayside, which is about an hour north of Edinburgh, between Edinburgh and Aberdeen. And similar size to where I now work in Western Sydney, about 400,000 population, which is slightly smaller, but same kind of budget size. And we had 3 local government areas. And the start of our story was really about understanding what it is we had to do as a healthcare system. So we started to think about the fact that we didn't have any more money. In fact, you'll see there we had to find $20 million, $40 million a year in efficiency savings. We had what we called in Scotland the silver tsunami. We had a lot of people who were growing older, a lot of people who were moving to Scotland to retire, and we didn't have the resources to look after the demographics that were going to hit us. And from a safety and quality angle, we were still harming patients in our hospitals and in their homes every day. We weren't getting better at that. So we decided to focus on 3 things. We focused on waste, variation and harm. And we reckoned that if we spent our time really looking at improving the quality of what we did, actually the money would sort itself out. And that actually happened to be the case. We also knew we had a burning platform because in terms of where we worked, we had to wake up to a really hard challenge that if we continued to do what we did, we'd need to build another hospital. We had to think of something different to do. We had to care for our community in a very, very different way. So what we were doing wasn't an option to continue. And so we started to think of what we could do in 4 things. How we could become much more community-based, how we could escalate what we were doing on prevention, which we weren't doing enough on, how we could work to build capability and capacity with our communities in a fundamentally different way, and how we could help people to look after themselves, to be resilient, and to take control, as opposed to control being perceived as lying with the health service. So, as you were hearing, we started with the patient safety programme. We were the first hospital in Scotland to take on the patient safety programme, but such was its success that the Government of Scotland made it mandatory for every single LHD. And we now have a patient safety programme. We are 7 years on, and these figures were from last December, but you'll see that in 7 years, there's been some real improvements in safety, mortality, infection. When we talk about pauses, 10,000 pauses, that means for 10,000 patients, every time before their operation was due to start, the surgical team take a pause. Okay? And they make sure they're very clear about what the team is going to do. So there's been a lot of great work. And every single team that made that happen had a patient and a carer on it to help drive the improvement work. So from a very early stage, we started to see that some of our greatest gains had to happen by working collectively with the people we cared for. So what we started thinking about was not about counting harm, counting error, but how did we measure reliability? Because what our community was saying to us was, we want to know that it's going to happen for every patient every time. Not some of the patients, some of the time. So that's what reliability is all about. How can it be there for every patient? How can we learn from others? And how can we support the healthcare system to do this differently? So this was the first stage in the journey. This is what we started to learn with our community and our patients and our carers. How could we do this differently? Then we moved on to something you're going to hear a bit about this afternoon from Anne. We moved on to person-centred care. We started to realise that we were talking about conditions and illnesses. We were talking about patients as problems, not about assets. Yeah? And so the challenge was to start thinking really differently about how we talked with patients and carers about what mattered to them, not what mattered to the professional. And if you follow some of the conversation just now internationally, there's a fabulous piece of work going on called The Big Conversation. And The Big Conversation is about asking professionals to ask all of their patients, what's a good day for you? Yeah? And a good day is not about being in a hospital bed. A good day is what it would be like if you weren't in the hospital bed, and understanding that in a very different way. And we've had some really good examples of how people are doing this differently. So this is an example of a piece of work at York Hill Hospital in Glasgow. And one nurse came to what is a fabulous international improvement conference every April in Europe. And she decided to ask her patients, because she was in a children's hospital, what matters to you? But she thought the best way for them to express that was to draw it. So she started with one patient. She got that patient to draw what mattered to them. It went on the end of the patient's bed. She then did it for the whole ward. And today in York Hill Hospital, every single child, when they come in, draws what matters to them. The doctor has to see it. The nurses have to see it. The family can add to it. But that's the way of helping people express what matters to them. It was a bit of a challenge when some of the kids asked the doctors to tell jokes and sing songs. But, it's much more personalised. And, the big challenge for us is that, particularly if we visit people at home or we see them in hospital, we see them for 4, 5, 6 days a year. We sometimes don't necessarily understand enough about what happens the other 360 days of the year when we don't see them. And so, there was a real push for us to start thinking about how do you understand the lives of the people you care about, not just about the services you deliver. Right? Because that's actually what influences people's health and well-being. And how can we do more about that? The other thing that we became a lot more disciplined about was what we call harvesting innovation. And we did a lot of work with some organisations in the USA, particularly the Institute of Healthcare Improvement in Boston. And all the best organisations are never sitting still. What we learned was the best organisations in the world are always going out, always bringing new learning into their systems. They never rest, never think they've got far enough. And there's a great children's hospital in Cincinnati. And Cincinnati have got a great strapline because they don't talk about themselves as being the best. They talk about themselves as being the best at getting better. So they never rest. They always try to improve. I've put a couple of slides up for people to take away, and I'm not going to spend a lot of time on them, but there's 3 places at the moment that I'm looking at to get innovation, that I'm looking at for Western Sydney, and I'll leave them with you. The first one is NHS England, and NHS England are doing a 5-year plan. So what they are doing is they're describing for their communities what would life be like in 5 years if we had no boundaries between health, mental health and social work. What would that world look like? And they're going to be describing that in a piece of work that started 2 months ago. That's definitely worth watching. The other one is NUCA. Now, NUCA is a healthcare system in Alaska. And South Central in Alaska is a fantastic healthcare system. It's very rural. It has a lot of challenges. But they've decided to create their healthcare system around the 65,000 voices of the people of Alaska and the surrounding community. It's a fabulous place to learn from. So they're doing some great work just now about community capability building. They've dropped their ED visits. They're doing much more community support. And the culture is very strong. They employ most of the people who live in their area. So there's a strong hook to workforce and to the healthcare system. And the last one is Sulfur. And Sulfur's in England, but Sulfur has just undertaken a really interesting integrated programme of work for elder care. And they're doing some fantastic work about supporting elders at home. So 3 things that I think are worth looking out for. And what I would invite you to do is think about how you learn about some of the great work that's happening out there in local communities that could inform your discussion at your forum on a regular basis. And so the levers that you're seeing in those innovation areas are all about networks. These people don't create bureaucracies. They don't create layers and layers of hoops to go through. They just make things happen. They engage people in a very different way. And they're very asset-based. They think about everything in the relation to asset. The asset of the people they want to care for, the assets of the community, and the assets of the outcome. Really important stuff. Okay. So the next part of the journey was taken a stage further. So we decided we've done a lot of work in our healthcare system. We started to learn about personalisation. We can see there's some great work happening across the world. What's the next stretch? So the next stretch for us was to think about how limiting it might be if we only tried to find solutions in health. So we invited the police, the ambulance, the fire service, the education service, the housing service, local government, health, all together. We invited them all collectively to form a coalition with us. And the reason we brought ourselves all together was we actually wanted to look at everything that affected somebody's health and well-being. And you'll see that health is that little bit way down there. But actually, there's a lot of other things that affect how well, how vibrant, how resilient, how healthy that you feel. So we all got in the room to talk about it. And we decided we wanted to flip healthcare a bit. So normally and traditionally, certainly in the UK, when we used to draw pictures of care, we used to put the hospitals in the middle. And we used to put the patients on the outside. So we said, well, what would happen if we flipped it? Actually, everything starts in the centre. It's the home, it's the community, and actually how we support that needs to be very, very different. So this was a real challenge in terms of thinking. And so we formed what we called the Early Years Collaborative. And the Early Years Collaborative has a very, very simple ambition. It was to make Scotland the best place to grow up. Yeah? And apart from the weather, it could be the best place to grow up. Okay? Because we believed that actually everybody that we brought together, we all believed that the children of Scotland deserved something better. And at that point in time, we weren't giving them it. So we had 3 aims. We talked about creating positive pregnancy experiences. We wanted children all to meet their developmental milestones. And that we wanted them to start school in a very different place, mentally, emotionally, and physically. Now, there is research from places like Harvard that tell us that there are certain interventions, and these are some of them, that if every child gets them before the age of 8, the risk of heart disease drops. The risk of high blood pressure drops. So you can actually make the next generation healthier by actually focusing your attentions on the early years of the children you have just now. Some really exciting stuff in there. And if you go back to the patient safety programme, when we did the patient safety programme, we learnt about measurement. We learnt about data. We used to count how many infections we had. We used to do graphs like this to help us create safer systems. So we taught the education department and the housing department and police and fire, we taught them our measurement methodology. We taught them about improvement. And so one of the interventions we thought was really important in the collaborative was there is some real social gains and relationship gains from making sure every child gets a bedtime story every night. Yeah? And we put that into the collaborative. And so in every area of Scotland, we had nurseries who started counting how many children were coming in and had had that story. And they were sharing this with the parents. So the parents were coming in and they were starting to notice that they really had to make the bedtime story work. And so by the time they started to roll, that one intervention started to act at scale across the whole country. But just imagine the gains if every child gets personal time with somebody that they're close to and they get the experience of a story with that person. Just over time, the difference that could make. So there was a connection of where we were going. The first meeting of the collaborative, we had 800 people in the room. This was a Scotland initiative. We got them all to sign, because if you sign, you know, it's a pledge. And it was quite symbolic. And 800 leaders signed a number of pages of pledges that still are there today. The collaborative is still going on. It's in its 3rd year. And there's some really, really good work coming out of it. But only because we got together in a very different way. We fundamentally realised that health alone was not going to change outcomes for children. So how could we do this really differently? This is another place that we went to visit. This is Delancey Street in San Francisco. And Delancey Street is known as a place where some great work has happened. It was a complex. It was a complex that actually housed people who had drug and alcohol problems, sex workers, people who had criminal records. But what the complex did was they generated a different purpose for those residents. So in coming to the complex, in staying at the complex, it turned around for them a different purpose in life that caused them to set up a business. Delancey Street is an internationally known business in the States now. The residents who used to have a lot of professionals living in the complex with them are now self-sufficient. They look after each other. They have a social capital they didn't have before. They don't have the issues that they had before. They've got more order in their lives. They've got more self-belief and resilience. So different things are possible. And Praxis is an organisation in Scotland that went out to visit the Delancey Street organisation. And Gary Malone, who's the activist who leads that, came back and decided he needed to do something different in Scotland. So Praxis is a volunteer centre. And what Gary decided to do was to create a centre where anyone could come and offer to volunteer. And no matter what their history was, the centre would support them and would help them develop, but would also allow them to expand their experiences through volunteering. And that in itself would also give them more accessible opportunities to employment and other things to make more positive their life experience. And they still talk about an invitation to life. So volunteering for us became one of the avenues to start to create community resilience in a very different way, but in a way that was energised by Delancey Street. And a big part of what both those examples are about is about civic health. And when I started to work in healthcare a long time ago, 1979, I wasn't involved in conversations about community health and resilience and well-being. I was just in conversations about health. But what grabs me now is that actually a lot of my time is spent doing these kinds of conversations. Not because we want to engage with communities, because we want to partner with communities. And I think that's actually quite different. Yeah? We need to partner people that we work with, people that we live with in a very, very different way. We put up an innovation fund in the local area. And for the first time ever, we didn't allow anybody in any public sector organisation to apply for it. Only members of the community could apply to the innovation fund to get money for things that would create wellness in the community. And we were snowed under with applications. We had applications for, do you know what Wellington boots are? Yeah. We had like rubber boots. So we had applications for what we call wellies, welly boots. We had applications to set up walking groups. We had applications to support mothers and toddlers. We had lots of different things. But the power of it was it came from the communities themselves. And often they went and got an agency to help them, but it had to come directly from the community. And those little funds helped to get people thinking about wellness. Because one of the other things that the community told us was health is not top of our agenda. Actually, where we live, how clean our streets are, how safe we feel, what access we have to employment are actually what's bothering us more. You're not at the top of our list. You need to help us with some of the things at the top of our list. And so we've tried to do that. And, it does go back to this whole element about purposefulness. When I left Tayside some 18 months ago, we just agreed to give a sum of money to a community for them to decide how they wanted to grow their own resilience and to let that flourish. That's a big step for healthcare. Not to control something, not to, to leave it to be fairly free in its development. But that community wanted the chance to do its own thing. And my understanding some 18 months on is it's growing step by step, but it's growing in the right direction. So just to finish, the last point is all about us. Because the journey for us in Scotland taught us one thing. We experience lots of different things. We experienced a lot of really challenging questions. But the one thing that hit us hard was if we were not prepared to change the way we thought, it was never going to work. There's a great line from the Institute of Healthcare Improvement in Boston who talk about there's only 3 things you need to make change happen. And they talk about will, ideas, and execution. Yeah? So what they talk about is the fact that we could have the best ideas in this room today, but if we don't have the will to be different, if we don't have the passion to come at something and let go of things that are important to us, to let others do things, the best ideas are not going to fly. So most things don't get executed or implemented because we haven't spent time creating the right will in the room. And it seems to me that it would be a great job description for a community forum to be the will building network in a community, wouldn't it? That the compelling story for change that came through community forums, that would be powerful. So something to think about. But we've also been challenging lots of professionals to think differently as well. Yeah? This is not the way we've always done things. And the things that we see that make a difference is that we have to start working in a way that's about relationships. It's about connection. It's about creating infection. Infection through connection. Yeah? It's not about rules. It's not about control. It's not about bureaucracy. It's about letting networks emerge in the ground of your communities and your organisations and across organisations and letting them get on with it. In Western Sydney, we have a great line that we did talk about in Scotland, and Jill may know, my husband talks about it a lot, which is ask forgiveness and do not ask permission. Yeah? So don't wait to get permission to do something different. Just go and do it. You know, it's easy for me. I can only get deported. But you know, you may have more stakehold in the ground than me. But you've got to try. And you know, there's lots of people, and I've met lots of staff who've got great ideas, and they just hold back because they don't think they've got permission. So you need to just tell people all of the time, do it. Yeah, and it goes for all of you as well. You just get out and do it. So. I like Einstein. I think this is great. We've, in big, complex, traditional systems like healthcare, we tend to think that the way we solved problems 40 years ago might be the same way we might solve them today. And it's just not going to happen. So we have got to bring something different to bear. So this is what we've talked about in summary today. This is what I've seen in my experience as the steps you need to have to create some change. So what's your burning platform? Yeah? What is it that needs to change, can't stay static? What do you know about improvement? Have you got enough knowledge about improvement? Do you need to be taught? Yeah? Everybody can be taught about improvement. It's really important. How person-centred are you in thinking about what needs to be different? And how do you know what the best of the best are doing today? You've got to go and find it. Who could you create coalitions with? Who's out there that you don't traditionally work with, but they're dying to work with you? Where are they? Go and find them. And what might be your challenge to promote civic health and resilience for your own region out here? And lastly, your leadership role. So everybody's a leader. And everybody's got permission now to be disruptive, haven't they? My chief exec tells everybody that my job is to be the disruptive innovator in his system. So I disrupt and he cleans up after me. But that's that's how it works. We need that. So my invitation to every single one of you today is you have all got the ability, the space, and the passion to be disruptive innovators for your own community. And I look forward to hearing over the next year just how, I want to hear the disruption from Sydney. I want to hear the energy and the noise. So I really look forward to hearing how you go. And thank you for listening to my story. Thank you.